Dr. Solante, let's start off with your reaction to today's case count.
Well, that's really alarming because from 5,000, then we have now 7,000, and that can really be a problem now among hospitals. We're beginning to feel the cases that has been admitted in our hospitals, both private and public or government hospitals.
That's right. We've all heard the reports. So at this point, Dr. Solante, should the government implement stricter protocols like ECQ perhaps as brought forth by OCTA? They're suggesting a hard lockdown for NCR. Does this spike warrant that drastic measure?
Yeah, I think the government now should look into this. No, the cases now is more or less higher than what we experienced before in last year's July or August. So this is the highest, and we don't want this to escalate more in the next 2 to 3 days because that will really overwhelm our healthcare facilities.
All right, at this level, 7,100 cases, how long do you think before we overwhelm our healthcare facilities?
It depends on the current distribution now of cases that are admitted because as we always know, when you look at 7,100, like 3 or 4% of these are in the moderate to severe, then if it's only, if half of this is in Metro Manila, then I would say a lot of these hospitals now are more or less above the capacity of the allotted beds for COVID-19.
That's right. But in spite of us reaching this capacity, a lot of other health experts have also told us they are more equipped to handle this caseload now, or at least COVID-19 cases now a year into the pandemic. Will this in any way kind of better help hospitals and healthcare workers to manage this spike?
It may more or less help us, but it doesn't, meaning if you have like your bed capacity is 150 and you're handling 200 cases and half of these are critical, even if you know how to manage, it will still boil down to the fatigue and burnout of healthcare workers manning a 200 capacity, 200 patients, but the capacity is only like 150.
That's right. And all this, Doc, is happening as we are almost running out of on-hand stocks of vaccines. Having said that, are you in favor of Health Secretary Duque's proposal to divert the vaccines from low-risk areas to COVID-19 hotspots, in this case, of course, the NCR?
Yeah, that makes sense because in an area where there is high risk of transmission, then we have to prioritize the vaccine, especially given the premise that our vaccine is limited. No? So in this limited supply of vaccine, then I think it makes sense to allocate the vaccines to this high-risk area, protecting our healthcare unit members, the facilities that are taken care of by the healthcare workers. So I would agree with that.
All right, and Dr. Solante, before we let you go, any other recommendations to prevent a further uptick in cases during the Holy Week celebrations? Understandably, a lot of people might be staying home, but a lot of transmissions happen within homes. How do we self-manage ourselves this coming Holy Week?
So we always imply that even if at your home and then you have mild symptoms, you always have to inform your barangay if you have symptoms. Testing is very important at this point in time because we don't want to let anybody be symptomatic, even the mildest symptoms, and exposing your relatives, your vulnerable high-risk parents or grandparents, that will make them be the ones that will be admitted in hospitals.
All right, thank you so much for your time. Dr. Rontgene Solante, Infectious Diseases Head of San Lazaro Hospital. Thank you, Doc.
Thank you.